There is some good news on the COVID front, and that is that we are seeing improvements in our statewide percent positivity, cases, hospitalizations. In fact, yesterday we dipped below 1,000 hospitalizations for the first time since July. All things are relative. I mean, that's much better than the 3,022 we saw at the peak of the fourth surge, but it's 4 times higher than the baseline hospitalization numbers that we had going into the fourth surge. And that's because we had fewer than 300 people in the hospital statewide before the Delta surge actually took root in the state of Louisiana. So the bad news is that there's still a very high level of COVID in the state of Louisiana. In fact, in all 64 parishes. The current weekly transmission rate is 243 cases for every 100,000 people. That's 2.5 times what the CDC would categorize as high. Dr. Canner will go into this more in just for a moment. But I think it just bears repeating that every community in the state of Louisiana continues to have a high amount of COVID, and they're in the elevated risk category as a result of that. So we are moving in the right direction, but as I mentioned before, our baseline numbers are still far too high. We're also recovering from Ida as we continue to navigate through the pandemic, and that caused some disruptions with people moving about, with a lot of people coming in from out of state, people moving in with one another, but also we lost some days of testing, particularly in southeast Louisiana, because of the storm. And I've received the recommendations of the Department of Health, and I'm going to accept those recommendations. And so I just signed an executive order extending the current mitigation measures another 28 days. So that is the statewide indoor mask mandate, including K through 12 schools and college campuses. I think this is incredibly important, and you'll get more information on this in just a moment. But the CDC has put out information that shows that schools without masking requirements are 3.5 times more likely to have a COVID-19 outbreak than schools where children and staff and members are masked. Further, we know there's a lot less disruption to schools because far fewer children actually have to quarantine when there is a positive case identified at schools, when both the individual who tests positive and those in close proximity to them are wearing masks.